Thank you, Destiny. This month, Black History Month, is celebrated, but it's also Heart Health Month. We're talking about heart health awareness, and we know statistically some illnesses affect and impact African Americans more than any other race, and that includes hypertension. Joining us now with some perspective on that is family nurse practitioner Tim Fleming from Brookwood Baptist Medical Center. Thank you for joining us this morning, sir.
Thanks for having me.
First of all, talk about hypertension for people who don't know what that is, that condition is.
Well, it's a condition, it's a chronic condition where the blood pressure within the arteries is high consistently, in a nutshell.
And obviously, the really serious health effects of that, the impacts of that, could be several things, but mainly heart attacks, right?
Attacks, strokes, kidney disease.
So when you look at statistically, in terms of also what you guys see at the hospital in terms of people you treat, why do you think it is this impacts African Americans more than any other race?
That's a good question, but it's not a simple answer. Mm-hmm. There seem to be some genetics involved and also environmental factors that lead to hypertension.
So if somebody's out there, they're like, look, I don't want to get on that path. How do they avoid that? What kind of types of preventive methods can they do?
The first thing you want to do is maintain a healthy diet. If not exercise. I don't mean go join a gym, but just begin some basic things at home. I tell my patients to walk from your front door 10 minutes, walk back 10 minutes, eat less, portion control.
So that very little change can make a difference?
Sure.
Okay. Now what about limiting alcoholic beverages?
That helps too. Also decreasing your caffeine is also a big factor.
And when you say decrease it, like maybe how many cups a day is say?
Maybe 2. Some people now these days drink those energy drinks, which is like 5-6 cups of coffee in one, and that's just not good for the heart at all. So
that's dangerous. All right. In terms of treatments now, have we become more advanced in terms of the treatments and the drugs that we could take for that?
Yes, there are new medications on the market, but I tend to prescribe the older medications with less side effects, very proven to be effective.
What are some of the side effects you see in some of the newer medications?
Dizziness, nausea, nothing major, but typically there's some dizziness, some nausea.
But enough to get you alarmed to where you recommend the older ones. Yes. If people are wanting to see their doctors about that, what are some prescriptions that they would mainly want to think about asking their doctor about?
Questions or prescriptions?
Questions. Yeah, prescriptions, I'm sorry.
Prescriptions, I like diuretics. There's ACE inhibitors, ARBs. There are tons of older medications that are, again, safe and effective.
All right. So what's the earliest age that somebody might start to experience symptoms and ones that they should look for?
I mean, I've seen patients early, 16, 17, 18.
Really?
A big factor is obesity. Obesity is a big problem in the state. This state ranks 3rd in the country in hypertension, and it's the #1 condition I treat in my practice every day.
Now, could that lead to an enlarged heart, or could it exacerbate the condition of an enlarged heart?
Both. It can definitely lead to an enlarged heart, which is called heart failure. It can cause CAD, cardiac artery disease, stroke, we mentioned stroke, and also a heart attack.
All right, well, we want people to be aware of that. So yeah, I mean, obviously consult with your doctor, get checked out regularly, because you certainly don't want you to end up in a bad situation. Thank you so much, sir. We do appreciate your time.
Thank you.
All right.